So we'll start first with Catherine to talk about targets of bullying and bullying behavior.
Well, I think almost everybody I've talked to today has commented about the neurobiological underpinnings that Tracy Valancourt covered. I think that was really some of the images and the ideas stuck with so many of us. So thinking about the connection between experiences, drawing on some of the adverse childhood events literature, as well as understanding the mind-body connection and how bullying gets under your skin. I think this also draws our attention to models of what we call allostatic load, about how your prior experiences with stress and trauma make it more challenging for you to rebound when future events occur. So you think about individuals that are in such a vulnerable position that they've had chronic exposure to bullying and that they're really not able to respond, whether it be cognitively or academically in a school setting or socially to their peers, and really that process of dysregulation of the HPA axis. I think that was very critical. And as we think about extensions of that work into prevention, there is a movement, and this was brought up by one of the questions from the audience, about trauma-informed approaches. We didn't talk too much about that, although there are a couple of models that we really might want to think about. One I've been working with is cognitive behavioral interventions for trauma in schools, the CBITS model, developed out in LA by the LA Unified School District. I think that might be a particular model that we could think about, although originally developed for youth that had other types of trauma. We could certainly think about peer victimization as being a type of trauma that we could examine. So that's more of a tier 3. And along that type of framework, we need a lot more intervention work as we think about how do we understand research around risk and protective factors for those more advanced tiers. I think that was highlighted by some of the comments that were made on the first panel about risk factors, but we don't really know and don't have a wide list of evidence-based programs for youth that are actually actively involved in bullying. Another theme that came up was around context, and we could think about this as the peer network context. We could think about dating relationships, cultural differences, urban versus rural, cyber as a context, and to some extent, obviously, a family context. Just many of these contextual factors are things that we're rarely able to really bring into our research designs, and sometimes we're not even really very good at addressing when we think about our intervention models. We can talk about context influencing implementation quality or issues around adaptation, but we need a much richer understanding around context. Sometimes in our statistical models, we use multi-level modeling and try to plug up variance at different levels and say student-teacher ratios and things like that, or this is what the school environment looks like. But rarely are we really able to walk away with a good statistical model that maps onto what people actually are seeing in real life. So we need better understanding of how we operationalize context. Developmental factors, what are we doing across the life course, and thinking about early risk factors for involvement in bullying and how that relates to interventions across the life course. This idea of life course, in fact, that was in the title of this conference, but frankly, we've been focused so much on a K to grade 12. We haven't talked at all about an undergraduate population, even though our youth are largely undergraduates. I get a fair number of calls from college campuses saying, how can we deal with this issue? And they've been dealing with issues around dating violence, so some of the work that Dorothy Espelage does kind of connect that for us. Another theme that came up clearly was around connectedness, the importance of peer relationships with each other, having that one supportive peer, having a relationship with adults that's positive as a potential buffer. And none of the research in that area about the one individual is experimental to be able to say that's going to be our intervention approach. It's certainly correlational, but it does highlight the importance of those relationships and pro-social relationships and having other kids that you can trust. Reminded a little bit of Christina Samavillo's work in terms of looking at the impact of victimization, and so when you do feel like there are other kids around you that are willing to stand up for you and be able to intervene, that's a really big buffer for those kids. So even if they are victimized, being in a context where they have peers that are willing to help them out, that helps buffer that experience. And finally, issues about diversity. And putting together this conference, we spent some time thinking, well, should we have a panel on diversity? Should we talk about different groups or ethnic factors? And we decided actively not to do that because we wanted that to be a thread throughout. But the risk of having it be a thread throughout is it looks like it's overlooked. And so that's one issue I did want to bring up, and that we did think seriously about issues of diversity, whether it be ethnic or cultural diversity, individuals with disabilities, LGBT populations. So I wanted to highlight that as an issue and make sure that it didn't get lost in our conversations. Sometimes I think we hit on that issue more directly, and others we slipped away from it. But I think as we were trying to wrap up and think about future directions, we need to make sure issues around diversity are very clear. So thank you.
Thank you.